How far can artificial intelligence really go in physical therapy practice? Today we're exploring how AI is changing clinical reasoning, patient care, and professional education, and where its limits still lie. Our guest is Dr. Michael Rowe, physical therapist and director of digital innovation at the University of Lincoln's School of Health and Care Sciences. His research focuses on how AI and emerging technologies can enhance learning, improve decision-making, and shape the future of physical therapy education and practice. I am Mariana Parks, physical therapist, and this is PT Pro Talk, where leading clinicians share practical insights to elevate your practice. By the end of this episode, you will understand how AI can support clinicians as a thinking partner, from documentation to diagnosis, and how to integrate these tools ethically and effectively into your own workflow. If you're new here, don't forget to subscribe so you don't miss future episodes. Now let's dive into today's discussion. PT Pro Talk is only possible with the support of the forward-looking and innovative companies like NeckCare,
treating neck impairment. Get objective neck assessments with the NeckCare system. Learn more at neckcare.com.
Hi, Michael. Welcome to PT Pro Talk. How are you today?
I'm very well, thanks. How are you?
Good, doing good. Thank you so much for taking the time. And let's just get started talking a little bit about yourself and your career.
Thanks very much. I'm a physiotherapist by background, although it's been a long time since I've done anything practical. I did most of my clinical work in the UK and Ireland, and then went back to South Africa to do a master's. And my master's took me towards the internet, which was just kind of kicking off at the time, and I was looking a lot at online education. And I think since then, I've been working mainly in academia and doing research at the intersection of what I would say is education, technology, and healthcare. And over the last 5 years, or about 5 years ago, I started getting interested in AI in professional and higher education. And over the last 3 years, I've been thinking a lot about generative AI and health professions education.
Before we continue our conversation, I wanted to take a quick moment to tell you about a special offer from Sarah Health. Visit sarahealth.com/ptprotalk for a 90-day free trial. That's sarahealth.com/ptprotalk. Make RTM simple to Sarah Health. That's sarahealth.com/ptprotalk. And now let's get back to our conversation. Yes, I was going to ask, so how did you become involved with AI? Like, wow, how that happened?
Yeah, so I think the general interest with technology enhanced learning, my interest has been on supporting student learning from the beginning, and initially that was about technology more broadly. It became more focused specifically on the internet, and then about 5 years ago, maybe a little bit longer, I started paying attention to AI. I thought there was quite a lot of work that was happening around things like planning, reasoning. Obviously, artificial intelligence is much bigger than the kind of general focus on generative AI at the moment, which is just a small part of natural language processing, which is itself a small part of the kind of wider research landscape in artificial intelligence. So I was interested in it more broadly, also kind of robotics. And it was always just kind of a tangent, something I was interested in on the side. And I had a conversation about 5 years ago with a colleague who was saying, look, if you think this is going to be important, then you probably should commit to it. And so I started doing more and more work. I think I published a paper in academic medicine a while ago talking about machine learning and the impact that I thought that was going to have on the profession. So kind of looked at what are the core functions of physiotherapists. So you might say something like clinical reasoning or observation. What are those kind of things that we would regard as being core to the profession? And then worked with some colleagues to say, what are the areas where AI is starting to make inroads into these core functions? And that was probably a piece of work that we published, I think, 5 or 6 years ago. And since then, I've just been looking more and more at AI and its impact on practice and professional education, just with the idea that I think this is really going to have a big impact moving forward.
Quick pause to share something exciting. I've been working on a new tool for prescribing home exercise programs that fixes a lot of the frustrations PTs have shared with me. You can upload your own videos, update plans anytime without creating new links, and share them instantaneously. No apps, no patient logins. You can even see how often patients open their exercises. If you're curious and want early updates, join the interest list using the link in the show notes. All right, let's get back to the conversation. I know you mentioned briefly, but you could talk a little bit more about that for the listeners that are new to this topic. So, what is the generative AI that you mentioned?
Yeah, so I guess you can think of generative AI as a next word predictor, and that's a super, super simplified description, but that's essentially what it's doing. So language models basically are trained on enormous corpora of data, so essentially the entire internet, and they're trained on the association between words. And when we ask a generative AI model like ChatGPT or Claude a question, it's taking our prompt and it's saying, based on the words in this prompt, what are the words that are most likely going to be related to a response? And so it starts off with one word and it says, what's the probability of the next word in the sentence being this? What's the probability of the word after that being this? And that's all it's ever doing. It's just doing statistical modeling of the relationship between words and making predictions about which is the next word in the sentence. And maybe just to sharpen that idea up a little bit, this is one of the reasons why AI finds it quite difficult to write a paragraph of 50 words, for example. It's because it can only ever see one word ahead. So it can't map out the entire paragraph in its mind and then write it out for you so that it gets to 50 words. Whereas as a human being, it's difficult for you to do that as well, but we kind of go back and forth all the time and then we come up with 50 words. It's really hard for AI to do that. It's getting better at doing things like that because it has something called chain of thought. So we can look at what it's thinking as it's trying to come up with a response that maps onto exactly what it is that we asked it to do. I think something else that's important to recognize is that generative AI is increasingly multimodal. So by multimodal, I mean that it can understand, and I say understand in kind of scare quotes, it doesn't really understand anything, but it can understand images, video, and audio as well as text, and it can transform information between those different formats. So you can give it a piece of text and say, turn this into a flowchart, turn this into a graph, turn this into a picture. Or you can give it a picture and say, tell me what's going on in the picture. And just as an example, you can this is an example that I give at presentations, upload a photograph of a physiotherapist doing something like a horizontal adduction test for shoulder impingement or some other related condition. And you strip out all the metadata and you just say to the AI, tell me what's going on in the picture. And it will say, well, that looks like a physiotherapist. It looks like it's doing this technique. Usually you would do that kind of technique for these kinds of conditions. And it basically does what you might consider to be a differential diagnosis, just based on the image. So it can understand images and video really well. And so the way that I know that this is kind of a long rambling answer, but the way that I think about generative AI is that it's kind of intelligence on demand, and it's for free and it's for everyone. And so if you've got a connection to the internet, then you've got this kind of intelligence that you can carry around in your pocket. And the question that I encourage people to ask is, what kinds of things are you capable of when you have access to this kind of advanced intelligence in your pocket?
Mm-hmm. And now just a very basic question, but how is that different from like search engines? Like you said that they have the next word prediction, right? So like what is the difference basically from the normal search engines?
So the way that normal search works is that Google and other search engines have these things called crawlers, web crawlers, robots. They crawl the internet and they basically establish relationships between links. So they follow all the links and they kind of have this map of what the internet looks like. And so when you put a query into Google, it goes through its database and it goes through all the links, and there's like billions and billions and billions, maybe even trillions of links, and it finds the links to the ground truth, the source that it thinks is going to be most relevant to your question. And so the difference with natural language or generative AI processes is that generative AI is starting from scratch, generating its response from scratch. It's not going to a database and retrieving information the way that Google does. Google will retrieve something from its database and present it to you as a series of links. You then have to go and read the links or the content at the links and make sense of it. Generative AI, we can assume that it's read everything, it's watched everything, it's listened to everything, and it's going to make up a response based on the prompt or the question that you've given it. There is no database, there is no ground truth that it's referring to when it's generating its response. And in some sense, people will talk about this idea of hallucination, where they'll say the AI is just making stuff up, and they call that hallucination. The reality is that everything that generative AI is saying is making stuff up. It just so happens that increasingly what it makes up has a lot of overlap with what we regard as being true about the world. So when it makes something up that we think is not true, we call it hallucination. When it makes something up that we think is true, we say, no, that's true. But the reality is that even the stuff that we think is true is made up.
So how do we know if it's true or not?
This is the thing. So it's getting really hard to make decisions about whether or not what it's telling us is accurate. And I would rather say accurate maybe than true. So the accuracy of the information is something that we can evaluate it against, but increasingly you have to actually be at the cutting edge of that domain in order for you to make a decision about whether or not what it's saying is accurate, because it's getting really accurate, to be honest. You can also start using the kind of paid for versions of these models that are connected to the internet, and they can produce citations for what it is that they're telling you. But again, in order for you to actually follow up and to confirm for yourself that what they're telling you is true, that's going to take quite a lot of time for you to go and do all of the reading that's required for you to see whether or not this thing is actually being accurate or not. Google's Gemini model, I don't know if it still has this, but at one point it had an option where you could check the provenance of its data. So it would give you a response and you would say something like verify with Google. I don't know exactly what the language is. And then it would color code its response, where like the green would be based on specific sources that it would cite. It would have like orange, where it would say, I'm pretty confident that this is true. And then the rest of the response, where it would say, I don't actually know about this. But yeah, increasingly you can actually ask language models to cite its sources, and you can do that with the paid versions. I'm not so sure about the free versions.
So like I just got a little surprised when you say that they make stuff up. Sometimes I feel like they do when using. So like you said that there is no truth, but so how they process the information then? Like if you it's just like a probability thing?
Yeah. So, but I mean, like if you think about it, that's a lot like how your mind works. Like you don't have a database of information where you've got a specific piece of like a fact. You don't have like, there is no place in your brain where you have a fact that is stored, and you don't go to your brain and you don't recover facts from a database. You're also making stuff up as you go along. You don't plan out your entire paragraph. Like I'm talking to you now, I'm not planning out what I'm about to say. The words are just coming to me as I'm speaking. And that's a lot how generative AI works. You can, like I said, I think with the paid version of the models, you can say, base your responses on, you can upload context. So base your response on this context. So what I tend to do a lot of is I provide language models with context. So I'll upload a document, a research paper, maybe a lot of research papers, maybe my own writing. And then you would ask it to generate its response based on that writing. You can go to ChatGPT and you can turn on web search, and then it will refer to specific sources on the internet when it generates its response for you. So you can use some of the functionality in these language models to increase the amount of confidence that you have in their responses. But if I were to ask an AI for, what is the most cutting edge research on the topic of, I don't know, rehabilitation for someone who's post ACL repair, I would have no idea if what it's telling me is true. I could probably look at it and I could probably say, well, that seems reasonable, but I would have no idea if what it's telling me is actually cutting edge. And in order for me to determine whether or not it really is cutting edge, it's going to take me so long to determine whether or not it's right that I probably wouldn't use a language model to ask that question or to answer that question if it was a high stakes response or if it was a high stakes decision that I needed to make. Like I wouldn't I wouldn't go to Claude and ask it for the best treatment mechanism for a patient if I wasn't an expert in that area.
Yeah, yeah, because you would be able to judge. So, what do you think that are the main potential roles of AI in healthcare? Like, as we are getting in the topic, because we have a lot of clinical, like rational decisions we have to make. So, what would be their role in healthcare, in your opinion?
Yeah. So this is that's actually a really big question. And so, maybe I'll kind of try and give what I think of as an overview, and then, we can see if there's any areas that resonate that we maybe want to drill deeper into. So there are already kind of uh, attempts to integrate AI into practice, and these would be at the administrative level, where I think there's a lot of activity around this. So ambient audio is something where you've got an AI that's listening to a conversation between a clinician and a patient. The AI transcribes the audio conversation and then provides a set of notes that the clinician can then integrate it into the electronic health record or medical record. And so you would just go through the transcription and say yes, yes, no, make some changes, whatever. So that's already commonplace in the US, less so in the UK. But there are areas in the world where this is kind of becoming quite common. There's a lot of interest in integrating AI into the electronic health record itself, so that the clinician is supported in their decision making based on the information that's in the health record. So another kind of supplement or augmentation of clinical reasoning. There is also interest in kind of more structured use of AI, where it's less about using generative AI and more about, I guess, maybe fine-tuned or expert. I forget exactly what it's called, but it's like essentially expert AI. I don't know. It's got a different name that I'm not 100% familiar with. And these are expert systems. That's what they are. So they are built from the ground up to support clinical decision making around things like diagnosis. So they would ingest information from medical databases. They would be fine-tuned with clinician feedback. There'd be kind of best practices and standard protocols that are built into that kind of AI. And those are the kinds of things that might be validated for being integrated into practice, where they may even kind of help you make real decisions. I don't know if I would use ChatGPT and Claude and Gemini for that kind of thing yet.
Mm-hmm. Mm-hmm.
My interest is really more around the use of generative AI as a thinking partner. So it's very rare that I go to Claude, which is the language model that I use most often. I don't go to Claude and say, give me the answer. I say, here's a difficult topic that I'm trying to understand better. I'll give it some context. I'll maybe upload a document that I'm working on. I'll upload some notes that I've taken. So I might have written some reflections. There may be one or two emails that I'll kind of, just take the kind of substantive content of the emails, no personal information. And I give all of that to Claude and I say, I'm trying to deal with this difficult concept, or I'm trying to deal with this complicated scenario. How could I think about this? This is the direction that I'm trending towards. What assumptions have I made? Why could I be wrong? What are the ways in which I'm thinking about this that are biased? Because I am biased. I have made assumptions. Like we all are biased. We all make assumptions. And so Claude can take a position that is different to mine. And so it can give me 3 different kind of prompts that I can use to think about the problem in more detail than I would be capable of doing on my own. So this is kind of like when you have a conversation in the clinical context with a peer or a colleague, and you say, I've got this patient who's presenting in this way, and I've been trying to manage the patient using these 3 kind of management approaches, and it hasn't really been helping. What am I missing? Are there other things I could be thinking about? Are there other questions I could be asking? Are there other approaches that I'm not aware of? You're not asking your colleague to tell you the answer. You're asking them to help open up your thinking. And this could be especially useful for students and novices who maybe have kind of very specific pathways that they tend to travel down when it comes to diagnosis and management. So the management of like back pain usually is like these three things. I'm going to do these three things, regardless of what the actual cause is. I'm not saying that's right, but that tends to be kind of a novice approach. You can imagine a novice practitioner or a student having a conversation with an AI saying, I've got this patient who presents in this way. This is the approach I'm thinking of taking. What am I missing? Is there something else are there gaps in this approach? So, like I said, there's a lot that's going on with AI in clinical practice, a lot of different approaches. We haven't even talked about robotics. There's a lot that is going on around robotics in clinical practice. But I think that the really powerful use of AI is in helping me as a clinician, or any clinician, to think differently about complex problems.
Mm-hmm. No, that's very interesting. So as you were talking, I just wrote down a few questions. So when you mentioned the use in the EMR, right, for like the clinical reasoning, helping clinicians based on the chart. So how would that, in practical terms, work? Like they would read the patient's information and give suggestions, or how? What did you mean by that?
Yeah, so the AI will be integrated into the. Now, this is not ChatGPT or Claude. This would be something that, like, the NHS would license from a different company, and it would be integrated at scale across the system. So that we're not really at that point yet, but there is preliminary work where people are showing that, there might be. The very simple version of this is that you prescribe the patient a certain kind of medication. This is obviously not a physiotherapist doing this. And then the AI will flag that medication or that dosage is, probably not correct for a patient who's got this kind of body mass index or something. Or there's two drugs here that have, I don't know, they're going to have a negative impact on the patient outcome. Or you've been doing the same technique with the patient for the last 3 weeks, and your quantitative metrics that you've been capturing haven't really demonstrated the kind of improvement that we would expect to see in a patient at this level at this time, something like that. So it would initially more be about picking out specific data points and looking at relationships between those data points, and then trying to question you to see whether or not you've missed something, or maybe there's something else you should be thinking about. And again, I don't actually know of any examples where this has been implemented at scale. But that's the kind of thing that people are thinking about with the EMR and AI integration.
Yeah. On that first one that you mentioned, to transcribe notes, right? I think that's something that people are already using.
Yeah,
I've
yeah,
seen
that's fairly
some.
common in America
Yeah,
now.
yeah. So, and then how would that work? Would you just, tell what you did with the patient, and they would transcribe so you don't have to type?
I think it listens to you while you're speaking to the patient. So
Oh, during the visit.
yeah. So like it takes, all of that effort, the kind of. So either you're sitting down and you're facing a computer while you're talking to your patient and you're capturing information while you're talking to them, or you're going to capture that information after they leave, and then you've got to hope that you remember everything accurately. And then that adds additional administrative workload. But the way that these ambient kind of audio systems works is that they record your conversation while you're speaking to the patient, and then they fill in the EMR, and then you just go through it afterwards and check to make sure that it's captured the information correctly.
Mm-hmm. It's like you have a meeting. People now have this take the notes, take notes while you're in the meeting, and then they send you a summary after with the main points that were discussed. So it's kind of similar to that.
Yeah, exactly like that.
Okay. And I thought the other point that you mentioned was super interesting. Like you said, the expert systems, right? That um, they help you to support the diagnosis, but it's not just a simple search, right? It's almost like you are training that system with putting information, getting feedback, um, to help. It's almost like you are putting your brain there in like all the database, and then getting feedback and training to help you, right? How would that, is that like something that's already in practice? So how would that work? And like, how would you use it in practical terms?
So I think like expert systems, like people talked about it as good old fashioned AI. It was the idea that you could use symbolic representation to map out what something like clinical decision making looks like. So, You might say that in this system, clinical reasoning looks like this. We've all seen those diagrams that show what clinical reasoning supposedly looks like. You maybe start with a complex problem, and then there's your initial training. There's evidence-based practice where you get input from the research database or the literature, the patient contribution, your clinical experience. You might have a conversation with a colleague, and it kind of walks you through what that process looks like. Now, imagine if we could capture that process in a logical system. These are what these expert systems are. So they kind of try to follow a logical pathway through a decision-making process that is inherently complex. And the earliest versions of these were really brittle. They would break. They didn't deal well with real-world scenarios because the real world is very messy and complex, and we can't predict in advance exactly what this process is going to look like. But expert systems, to some extent, try to map what that process looks like. So they would ingest like all the clinical literature around whatever, managing a patient with lower back pain. There would be clinicians who would input information into the system in very structured data structures. There might be people who would evaluate different outputs from the system. You would feed it many, many case studies. Maybe you get patients to contribute. And so all of these things build up in like an expert system. And then the idea is that you would go to the expert system and you would ask it questions, and it would try to replicate what an expert would do in that situation. And IBM's Watson, I think, was a version of this, which did really, really well in the kind of pilot sites where they experimented with Watson. And I think it was oncology and specific centers in the US. But when they tried to roll it out into other areas where the context was different, then Watson did really poorly. So these expert systems can be quite brittle, but in the right context with the right patient and the right clinician, expert systems can do really, really well today. But we're not really at a point where we can roll that out at scale. But you would essentially have a system that you would have a conversation with, and it might then give you guidance about how to think about managing your patient. Again, this is not ChatGPT and Claude and Gemini. This is a specific system that's built for a specific context.
So, like, for example, you said that it's not ready to roll out in scale. So if I am a clinician and I would like to uh, do that, is like, where should I go and what should I do? I don't know if it's even available, but like how we could start with that.
Yeah, you got to convince your government to pay an enormous amount of money to get access to those kinds of systems. I don't think that they're commercially available. The only one that I know of that was rolled out at any kind of scale is IBM's Watson, and that was specific for oncology, and it worked really well in certain contexts in the US, and when it was tried in other countries, it didn't really have good outcomes.
Mm-hmm. And like I've heard, but I don't know if that's how it works. Like, can you get your own like kind of bot and train your bot with your responses and your, like the things that you do with your patients, and then put more papers and try to give them all this information and tell, like, based on certain patient situations, how would you act, what would you do, and kind of like train to be your personal assistant or something like that?
Yeah. So I think that's possible. You can create what's called a custom GPT in Gemini. They're called gems. In Claude, you can do something similar with projects. They're kind of brittle though, and I don't know if I would trust it for patient management. This is complicated. So we're talking about giving the language model enough context to be able to help you in a useful way. I think that there is enormous value in having a language model that can be, it's not really trained, because the training phase is something that happens, beforehand to build the language model. And it's only really the companies, the frontier labs like Google and OpenAI and Anthropic, that can build and train language models. But we can customize the models to some extent. And so if we take the example of a custom GPT, if you pay for ChatGPT, you can build a custom GPT, and you can give that custom GPT context. So you can upload 20 research papers plus a book chapter plus your own personal reflections on managing this particular kind of patient. And you can do that for maybe there's 10 conditions that show up fairly frequently in your private practice, or even in your trust. So if you're working in the UK, there's NHS trusts, and in your particular place of work, let's say there's 10, maybe 15 kinds of patient presentations that you tend to see often. You can build a custom GPT for each one of those. And I think if you were really careful in how you set it up, you did a lot of experimentation, you had some expert input, I think you could probably build something that would be quite reliable and relatively trustworthy. You could then also, for every patient, go to that custom GPT and upload personal context from the patient. Now, you would have to be super careful about what you upload. No personally identifiable information. Has the patient given you consent to do this? Does your professional regulatory body allow for this? I'm not saying that anyone should do this. You need to, because there may be legal implications if you do. But if you were to do this, then this is one way that you might go about doing it. Now, if you uploaded some of that patient information that had been stripped of all personally identifiable context, and you had a conversation with your custom GPT, so it knows a lot about the condition, it knows a lot about management, it knows a lot about the patient because you've uploaded all of this patient context, you might be able to get it to give you an output that mapped onto the way that you would typically manage these patients. So it is possible. But if ChatGPT or OpenAI changes the language model that supports the custom GPTs, then all of the custom prompts that you've spent so much time building, they may not work anymore, or they may work differently. Or the language model may give you back something that is unexpected and is just this kind of random weird glitch that tells you to do something that you probably shouldn't do. They're not reliable in the sense that if you gave it 100 cases, you could be confident that you would get 100 correct responses. You may even find that if you gave it the same patient twice, you may get two different management plans. So I don't think that either one of those management plans would be wrong. I think that these language models are actually quite good at the moment at doing things that we would regard as being relatively good practice, but they may be different. Now, you may say, well, people respond differently to the same patient presentations as well. You might give a patient, or you may use one management plan for the same patient presentation on a day where you have maybe less resources, or you've got a really busy month, or whatever. There may be other factors that you take into consideration that mean that you do something different with this patient compared to another patient who presented in the same way. And so just the fact that the model can sometimes give you different responses, I don't think is wrong, but it's not what people expect with these kinds of systems. So again, like it's a very complicated question to just say, can you build your own version of this? Yes, you can build your own version of something like this. How much trust can you have in it? How much confidence can you have in its responses? I would say that that's a really great research project for someone who wants to, if you're interested in this, build a custom GPT, exactly how I've described it. This would be relatively trivial. Anyone can do it. You don't need coding experience. And then take 20 case studies and, change the variables, get the AI to give you management plans for all of these case studies, then take your responses to an expert panel and ask your expert panel to evaluate the responses and to score them. And if your expert panel comes back and says, yeah, these are pretty good, maybe you can, that's definitely publishable. And maybe you could start, trusting some of what these outputs are. I'm not saying you can, but I'm saying that would be an interesting research project.
Yeah. Because as you were talking about the expert systems, I was like, can we do that? Because we're gonna have to wait, I don't know how long to have something so reliable available. So in the meantime, can we develop something that would help us in practice? So that's the idea. And you mentioned about the prompts, if they change the language model, and then like the prompts would not be Exactly. So what do you mean by that? Like they're updating the what is a language model, and we know that I know the prompts are really important. So how does that relate?
Yeah. So the way that they actually build language models is they don't take GPT-3 and make it better to build GPT-4, and then take GPT-4 and add something to it and make it GPT-5. That's not how they do it. They start from scratch. And so when they build GPT-3, they start from scratch, they build it. Then they build GPT-4, they start from scratch and they build it. And so the way that the model, I'm going to say, understands the world, which isn't really true. It doesn't understand anything. But the way that it thinks, the way that it responds to prompts may be different because the model is trained in a different way. So, for example, when OpenAI went from GPT-4 to GPT-5, they actually went GPT-4, GPT-4.5, GPT-5, there was an enormous outcry from a community of people who had built companion AI avatars that started behaving in very different ways when OpenAI upgraded from 4.5 to 5. The way that you could build these custom avatars, uh, well, the prompts were the same. The way that you build them is the same, but the way that the model responded to you was very different. And I found this in my own work. So I've got projects with built into Claude, and the way that Claude responds to me is slightly different depending on which version of the language model you use. And if you pay for any of these language models, you can choose different models in the background. So you could upload a research paper and ask GPT 3.5 to give you a summary. Actually, GPT 3.5 is not available anymore. But let's say Claude. If you go to Claude, you can say, summarize this paper, use 3.5. Summarize this paper using 4. Summarize this paper using 4.1. And you'll see that the responses it gives you are different. And so when the companies change the language model in the background, if you've got a workflow or a diagnosing machine built on a specific language model, you can't trust that it's going to behave in the same way when the language model gets updated in the background. Does that make sense?
Yeah. So could you just go back and use the previous one, or it's gonna be probably like as they evolve, you're not gonna be able to use the older version. So then you have to create everything again?
Yes. So this is what I'm saying. Like it's really difficult to build long-term workflows around a product that is changing every 6 months. So, and again, that's not to say that your custom GPT is going to be broken. It'll still work. It might be different. It might be more verbose. It might be more concise. It may be um, it maybe will have a different personality. I know that sounds weird, but it might talk to you in a way that's quite different. What is probably true, though, it will probably be more intelligent. It will probably have better reasoning capabilities. It will probably be able to do more things in the background as part of its thinking process to give you what you're asking for. So I'm not saying that the AI is worse when it gets upgraded or changed, but the experience and the output is different. It may be better, but the experience will be different.
Mhm. And how would you know, like, how to change your prompts based on the language model that's being updated?
Lots and lots of practice,
Trying and error?
trial and error. There is no, like, you'll notice that there's no instruction manual for language models. You just have to try and work out what works best, and then try again and keep on going through that process.
Yeah, that sounds like it would take a lot of, like, time and playing with it and trying to see what works best.
Yeah, there's a professor of economics at the Wharton School of Business called Ethan Mollick, and a while ago he said that it takes about 10 hours for him to come to terms with a new language model. So whenever these things get updated, he says, maybe that time has come down a little bit because the changes from one model to the next are less extreme than they used to be. But
Mhm.
I think if you set aside, 4 to 5 hours after a new language model comes out, you'd, I think, develop an intuitive sense for how it has changed in response to the kinds of questions you ask.
Mm-hmm. Okay. And like talking about rehab, we talk a lot about diagnosis and we mentioned briefly like a treatment plan. So like how would you use in rehab? Would you use the same way? Would you have any other different tips or advice for us to use in our practice?
Now, again, like this is a complicated question. So if there was a high degree of uncertainty about an approach to management that you had with a certain patient, so let's say someone comes in and they have something that you don't have much experience with, but you don't have the option of referring to someone with more experience, maybe because you're isolated and remote. There's lots of reasons why you might be the person whose responsibility it is to deal with the issue. So you can't refer the patient on. Now, I would feel fairly comfortable going to a language model like Claude. I would maybe download some relevant research papers from Google Scholar. I'd pick ones that maybe have high citations, or if I could identify experts in the area, I might try to find some of their sources. So essays they've written, papers they've written, book chapters they've written, give it to Claude, and then try to write quite a detailed case study of the patient. So I've been seeing this patient for 2 weeks now. I initially did this physical assessment. The patient has these kinds of symptoms, blah, 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 blah. So you don't have to give any personal information. And then I would say to Claude, this is the management plan that I'm thinking of. What do you think?
Uh-huh.
And I would use it as a peer to bounce ideas off of. I think that's a reasonable approach to using language models in a clinical context in conditions of uncertainty. But if this is a patient who has something that you are very confident in, you're an expert in the area, you've got a lot of clinical experience, why would you use a language model at all?
Mm-hmm.
You know what you're doing. Now, I might every now and again, I might go to Claude and say, I manage these kinds of patients very often. I see them a lot. I've got experience. I've done a master's in this area, or I've been on these courses. This is my typical approach to managing these patients. What am I missing? Is there something else I could be building into my management plan? And so again, I kind of come back to this idea of identifying my blind spots. I really use AI a lot to tell me what assumptions I'm making. How can I think differently about a subject? And maybe this is most useful in areas where I'm most confident, because those are the areas where I'm least likely to second guess myself and to try and make change. We all know there are people who have been practicing for the last 20 years and they're doing the same thing today that they did 20 years ago. Maybe those are the people who would benefit the most from having an honest conversation with AI. Again, you're not asking the AI to tell you what to do. You're not asking it for an answer. You're asking it for ideas. And I think there's very little risk in using AI for that kind of thing. If the AI tells you to do something or suggests something and you don't have any experience in that, or you don't feel comfortable doing that, of course you wouldn't do it. But it may open a door where you say, oh, maybe I should learn more about that. Maybe there's a course I can do that will fill in that gap in my understanding. So I think even in areas where you're very confident, AI, I think, has a role to play. And even when it tells you something that you don't completely trust, I wouldn't implement what it's told me, but I would see that as an opportunity to try and learn more about something that I would see as a gap in my understanding.
Yeah. Or even if you're stuck, like a patient is not responding well, it could be something that I missed on my diagnosis. What are the possibilities? Because if you're used to when things are progressing well, there is no reason to ask for a rehab or, maybe uh, some other ideas that you're not seeing that are preventing the patient from progressing in the treatment or
Yeah.
something like that.
Or the patient refuses to do the exercises I'm giving them, or there's fear avoidance, or there's something going on that's more kind of psychological maybe, and maybe that isn't an area that I feel super comfortable in. I might say, what is a different way for me to talk about the management of this patient with the patient?
Uh-huh.
I've been tending to be quite fact based. So I've been telling the patient, oh, you should do these things because the evidence base is really strong. Maybe the patient needs a more emotional example. Maybe I should try to connect with the patient on a different level rather than just providing the evidence. Um, so yeah, I think it can be really helpful again in providing um, different ways of thinking about problems.
So you mentioned like communication. I know we could use in more in other tasks other than just clinical reasoning and rehab, like some admin tasks, like we mentioned, communication, maybe some content creation, planning. So, what are other areas that we could use AI as clinicians that don't involve like the treatment itself?
Yeah, so I think customizing education materials for patients is really, really useful. We have kind of pamphlets and brochures that we give to patients. Do these exercises. How many times are patients maybe there's some issue that where it prevents them from doing it exactly like you have it in your brochure. Imagine you could have the AI suggest variations of these exercises that are specific to this particular patient. Um, so rather than you having to kind of come up with what those exercises might look like, the AI knows what your typical brochure looks like. So your patient education material, and it knows that in this patient's context, maybe they really struggle to get up from a lying position on the floor. So you've recommended that they do these exercises, but it requires that they get onto the floor or they get onto a bed or whatever the case may be. Maybe they've only got one leg, and there's all sorts of reasons why people might not do it exactly the way that your brochure says they should do it. The AI can customize those exercise programs so that they are specific to your patient. And this is the kind of thing that physios do all the time. But it's kind of an there's no, this is going to sound terrible and some people are going to get really angry, but I'm going to say like, there's not a huge amount of creativity and expertise that goes into that. I think a lot of people would probably disagree with me. And to some extent, I'd say you're probably right. I know it does take creativity and it does take forethought and it takes a lot of insight into the patient's personal life. But maybe that's what you provide. You provide the insight. But is it really a good use of your time to sit there redrawing these pictures so that patients can follow them better, or rewriting the exercises so that they are more aligned with the patient's personal context? I think that's a really good use of AI. The other thing is translation. So I'm from South Africa. We've got like 11 languages. And in some of the more rural areas, it's not uncommon for you to be the physiotherapist and you can maybe speak one language, maybe three. Probably not all 11. Now you can use AI to translate. So that, again, coming back to this idea of personalization and customization, you can customize your education materials for your patients. Also, just things like growing your practice. I do this presentation where I talk about the business of practice. How do you use AI to build social media campaigns? How do you use AI to write education materials that you can send out as a newsletter for your kind of different client groups in your practice? How do you use AI to restructure your website so that you can, I don't know, put the most important information on your landing page? So AI is really good. You can take a screenshot of your practice website, give it to AI and say, tell me how to make this better. Tell me how to make this useful for my patients.
Uh-huh.
So there's a lot that you can do that has nothing to do with diagnosis and managing patients. There's an enormous amount that you can use AI for to improve your practice structure, to improve the business of your practice, organization and operations. Like, there's a lot of physiotherapists who started private practice with no real experience of running private practices. Um, AI could work almost as a business consultant to give you advice on how you could think differently. Do you have a 3-year strategic plan for growing your business?
Mhm. Mhm.
AI can help you with that. So there's a lot that you can do that kind of gets you completely out of the concerns around diagnosis and managing patients on a clinical level. AI can be super helpful in loads of other areas.
Mhm. Um, maybe even like researching papers, giving some recommendations based on evidence on specific topics. as well?
Yeah. Claude, Gemini, and ChatGPT all have a function called deep research. And I don't think this is available in the free version, but in the paid version, you can go to Gemini, for example, you turn on the deep research functionality, and you can say, I want you to prepare a research report on the topic of, and you give it the topic, and it will go and it'll spend 10, 15 minutes doing the research, reading research papers, reading websites, and it'll write you a 20-page report on the topic that you've given it. And I've asked for those reports in areas where I am very confident, and I can evaluate. I do that so I can evaluate the quality of the report. And in my experience, they've been exceptional. Now, are they the best? No. Are they PhD level? No. But most physiotherapists don't have PhDs. Most physiotherapists don't really have a strong research background. So I would say that these are very good research reports on topics that can be quite complex. And it takes ChatGPT or Gemini maybe 20 minutes to do. If a physiotherapist wanted to do the same research, it would probably take them several weeks because they just don't have time to put into it. So it's not going to be as good as what the best human could do, but it's going to be good enough for someone who doesn't have the time to do that in the first place.
Yes, no, absolutely. And then I know you also have a course in optimizing learning, right? You said that you really like that topic. Um, so just briefly mention, so how can also educator and students integrate AI into learning and assessment and all of that?
Another really, really big question. I think one of the challenges that we face in professional education at the moment is that we find that students can use AI to complete almost all of the assessment tasks that we give to our students. So I don't know what it's like in other parts of the world, but I know in the UK, there's an enormous emphasis placed on the essay as a way of assessing students. Now, physiotherapists don't write essays, and yet we still use essays to evaluate student competence in certain domains in professional education. Now, AI can write perfect essays. So what a lot of universities are doing is they're saying, how do we stop students from using AI to write essays? I think the more important question is, why are you asking students to write essays in the first place? So I think that this question about how should students be using AI as part of their learning, I think it kind of brings us back to a deeper question, which is, what is the purpose of universities in the first place? And I think that's a very difficult question that a lot of institutions are struggling with at the moment. I don't think it's reasonable to say that students should be using AI to complete assessments that they then submit, where the point of the assessment is to test recall or to test students' ability to write an essay. So I don't think that that's okay. What I would really like to see is that we change the standard of what we do with our assessments. So rather than asking students to complete a poster that aims at raising awareness around childhood obesity in a community, for example, because AI can do that now, without even trying. What if instead we ask students to actually run a health promotion campaign in their community, and they pass if we see the level of childhood obesity go down? So, these are really difficult assessment tasks, assessments that you might consider to be impossible a year ago. They would have been impossible a year ago. But I would say that that might be a more effective way of assessing students' competence in certain areas, because we are actually evaluating an authentic context. This is what we really care about. We don't really care about students' abilities to create posters. Who cares? We care about students or new graduates' ability to make change in the world, to actually have a positive impact on patients and communities. So what if our assessments were more closely mapped to what we would expect people to be doing once they're in practice? So another example, we know that hospitals can be really inefficient. So they're really difficult places to make change because workflows can be really entrenched. What if a student on a clinical placement was tasked with evaluating the workflows within that clinical context and using AI to come up with a different way of thinking about patient throughput or triage or decoration. Like, hospitals are terrible places. They're terrible places to be. They're boring. And what if we ask a student to come up with a new design for hospital waiting rooms, for children's play areas? These are all things that would be really, really powerful if they could be implemented in a real world context, and they would have nothing to do with students cheating with AI. We would encourage the students to use AI. We would teach them how to use AI better, and the outcome is something that we hope has a positive impact in the world.
Yeah, and make a real impact, right? Than just
Exactly.
staying in the classroom.
Yeah.
Yeah. No. No, that's a very, very good ideas. Um, for healthcare professionals that are curious about AI, but they don't even know how to start, what would you recommend?
Just start. I've had conversations with colleagues who tell me now in like October 2025 that they haven't used ChatGPT yet. And I really don't understand, because it's free. You can just go to this URL. You can just ask it a question. Just say to it, like, what are you useful for?
Uh-huh.
If you have no idea where to start, just go to ChatGPT. If you're listening to this and you are one of those people who hasn't started using ChatGPT or Claude or Gemini or Perplexity or Copilot, go to ChatGPT and just say, I've never used ChatGPT before. I am a physiotherapist. What can I use you for? And just see what it says. I would give some advice. There is a heuristic that you can use, just a short kind of prompt that will help you build a prompt that is more structured and will give you a response that's more useful. And the heuristic is role, goal, instruct, discuss. You give the AI your role. I am a physiotherapist working in this area. If you're not comfortable sharing personal information, don't tell it exactly where you work. Say, I'm a physiotherapist working in a remote area in India, China, South Africa, whatever the case may be. My clinical expertise is in this. I tend to see patients who do this. Then you give the AI a role. I want you to take on the role of a critical friend. I want you to take on the role of a patient. That actually works really well. Take on the role of the patient. I want you to pretend to be a patient who is a 78-year-old lady with financial issues, whose husband passed away recently, whose children live far away. And the AI will then pretend to be that person. That's a really interesting exercise that you can do. So you give it a role, you give it your role, you give it a goal. The purpose of this interaction is for us too. I want to do this. I think that blah, blah, blah. So you give it a goal, then you say instruct. We are going to do this. Then we're going to do this. Then I want you to do this. And then you treat its response as the opening to a conversation that you're going to have that is ongoing. So don't ask it for an answer and then treat that response as the final word. Use that as a prompt to get you to think about the conversation, and then to go back and say, I want to talk about this. Let's dig into this more deeply. I disagree with what you said here. And then I think that after you've done that for a few minutes, I suspect that you will start to get a sense of what language models are useful for. So if you've never tried it, whether you're a student, a clinician, a teacher, start small. Go to AI and just start with a small conversation. Ask it for input on a problem that you're experiencing in some aspect of your life. Again, don't ask it for an answer. Ask it for ideas. Be transparent about your use of AI. If you've ever used it for student preparation, I don't know, if you're thinking about using it for education materials with patients, talk to your patients about it. Say, I'm interested in this. What do you know about this? Are you comfortable with this? Would you be concerned if I use this? So I think it's really important to be transparent about AI use. And I think just really think about AI as a thinking partner. It's not like a calculator where you ask it to do something and it's going to give you a perfect response. Treat it like a person. And people are biased, prejudiced, infallible. People make mistakes. People make things up. People lie. People cheat. People steal. So don't expect AI to be perfect. Treat AI like you would treat another person. Have a conversation. Assume that it's going to make mistakes. Don't treat its outputs as accurate or true or correct. just have a conversation with it and see where you end up.
Hmm. No, I think that's very important. So, people don't think that that's 100% accurate. They have all the information. They can be wrong, and people just blindly trust whatever the AI says. So I think that's also very important to make it clear for people that are starting to use, because I've heard many people saying that, examples of conversation situation that the answer was not accurate, and but they were testing, so they knew that wasn't accurate. But sometimes if you're not paying attention, you're just going to believe whatever they say.
But I would say the same thing is true of people. So sometimes people will say things to you that are not accurate. I know of clinical supervisors who regularly tell students to do things that are not accurate. So I think that's why I say treat it like a person. Just like you don't expect all human beings to be perfect, we expect that human beings will sometimes make mistakes. And yet somehow we've figured out how to build society around all these people who make mistakes all the time. I think we can treat AI in the same way. Expect it to make mistakes. Don't think of it as being perfect. But my friends aren't perfect. My children aren't perfect. My wife isn't perfect. I'm not perfect. And yet we can still have a interesting conversation.
Yeah, no, absolutely. And I know you also teach a few online courses, right? So if people want to learn more about you or your courses, how they can find you?
Um, there's a couple of places. I think LinkedIn is probably a good place to start. I kind of link to a lot of the stuff that I do there. My personal domain is mrowe, mrowe.co.za /blog. I can send you these links and you can put it in the show notes. That's probably a good starting point. And you can find the courses that I've created on AI at those links.
Yeah. No, your website, you have a lot of information there. So I recommend people go there to check and read. There's a lot of things there. Um, and before we wrap up, Michael, anything else that we forgot to mention? Anything else that you wanted to say?
Um, I think I think we need to have more conversations about using AI, whether you agree with its use or not. I think dissent is really important. I'm very positive about the use of AI, but I don't think that everyone should be in the same position where we're all just kind of rushing forward to embrace this technology. I think having difficult conversations is going to be important. So I think start using AI, experiment with it, see where it works, see where it doesn't work, start small, start a little learning community with people where you work. Experiment with different use cases, with edge use cases, share what you find with each other. I think that's going to be really important. I think if you find things that make your life easier, share them with other people. Because I think a lot of people share places where it fails. So the failure points are really easy to find on LinkedIn. You see a lot of people kind of saying how AI doesn't work for this, and that's fine. We need that. But I think it's also important to say, look, AI also does work really well in these particular contexts. So rather than expecting everyone to learn from scratch what works well, I think we could do a lot better at sharing what works well. I think it's really important that physiotherapists and other health professions are part of this conversation. Otherwise, we are going to be subject to the tools that other people build. So, if you have a voice in some kind of advocacy group, if you part of a national regulator, if you are contributing to institutional policy, I think that's really valuable. So I think there's a place for you, even if you're not technically sophisticated. You don't have to be really good at AI in order to have a role to play. You could be advocating for the patient, you could be advocating for the profession. So there's a lot of space for different voices in the conversation. So I'd really encourage people to participate as much as possible.
Mm-hmm. Michael, you're not going to build as an expert system?
No, not yet.
That would be a good project, isn't it?
It'll be a good project. It'll take a lot more money than I have, though, unfortunately.
Let's get some donors, some people that
Yeah,
want
if you're listening to
to
this and you want to sponsor some
invest.
research, give me a shout.
Oh, good. Well, thank you so much, Michael, for taking the time to come share a little bit about AI with us. I think it's a new field, so I wanted to bring this topic for a while to the podcast. So I appreciate you coming, share your knowledge, and help us, embrace this new technology, learn how to use it.
Thank you so much for the opportunity just to share some ideas. I hope it was useful for the audience. And if anybody wants to get in touch to chat about any of your concerns, or if you have any questions, please feel free to get in touch.
Thank you.
That's all for today's episode of PT Pro Talk. We hope you enjoyed this discussion. Be sure to follow us wherever you listen to podcasts so you'll be notified when we release future episodes. You can also join our email list at ptprotalk.com to receive updates and access new episodes. If you have ever gotten value from the show, please take a moment to leave us a 5-star review. It always makes my day and it really helps us out. If you have any guests or topics you'd like to see on the show, let us know by answering a quick survey. You can find the link in the show notes, along with more information about our guests, resources, website, and social media. Thanks again for listening, and until next time.